Hello, my name is Avery and I'm an active duty Navy corpsman. I'm going to teach you how to assess the airway for obstruction and perform a chin lift or jaw thrust maneuver to open the airway. These maneuvers will open the casualty's airway and allow for improved breathing. After removing the casualty from the threat area and assuring scene safety for you and the casualty, and controlling any life-threatening bleeding, you should assess the airway. If the casualty is awake and having no airway or breathing problems, ensure they are in a position that allows them to breathe comfortably. If unconscious, or if the casualty has facial injuries or potential obstruction, then kneel at the level of the casualty's shoulders and roll them onto their back on a hard, flat surface if possible. Then position yourself at the head of the casualty. Next, open the mouth and look for anything blocking the airway. You're going to look for cuts, obstructions, broken teeth, burns, or swelling, or other debris such as vomit. Remove visible obstructions immediately. Do not stick your fingers blindly inside the mouth to check for a blockage. Neck and/or spine injuries should be suspected in obvious head or neck trauma and in blast injuries or motor vehicle accidents. If there is no suspicion of a neck or spine injury, use the head tilt chin lift maneuver to open the airway. With the palm of your hand on the casualty's forehead, apply even backward pressure and tilt the head back gently. Place the fingertips of the other hand under the tip of the bony part of the casualty's lower jaw with your thumb on top and bring the chin forward. The mouth should not be closed. If needed, the thumb may be used to open the casualty's lower lip. Do not press deeply into the soft tissue under the chin with the fingers, as this could cause the casualty's airway to close. If you suspect a neck or spine injury, use the jaw thrust maneuver. Position yourself on your knees at the head of the casualty and rest your elbows on the ground. Place your forearms along the casualty's head to stabilize it, ensuring not to rotate or move the neck or head. Place your fingers under the curved part of the jaw, ensuring your fingers are below the ears, and place your thumbs onto the chin. Use your index fingers to pull the lower jaw up while using your thumbs to push the casualty's chin forward. If the casualty's lips are still closed after the jaw has been moved forward, pull back the lower lip and open the mouth to let air flow. Reassess for breathing using the look, listen, and feel technique. Look for rise and fall of the chest, listen for breathing sounds, and feel for their breath against your cheek. Rescue breathing may be required if breathing is not restored. After assuring the casualty has an open airway, place an awake casualty in either a sitting up position, the recovery position, or a comfortable position that allows them to breathe. To place the casualty in the recovery position, take the casualty's arm and bend it at the elbow, placing the hand underneath and behind the head. Take the other arm and lay it flat across the casualty's chest. Position yourself on the side of the casualty, bending their leg at the knee across their body, grabbing the patient's shoulders and hip and rotating them onto their side, ensuring that the bent knee is on top of the casualty. Place all unconscious casualties into the recovery position unless they have suspected head or neck trauma. If the casualty is unconscious and the respiratory rate is less than 2 breaths in 15 seconds, or if the casualty is making snoring or gurgling sounds, they may need a nasopharyngeal airway, and you should communicate this to responding medical personnel immediately. Document all medical aid rendered on the patient's DD 1380 Tactical Combat Casualty Care TCCC card if available. Inform medical personnel of your findings and any medical aid provided, and assist with evacuation as needed.